Hi, my name is Jindo Charian. I'm working as a shared care specialist nurse in ARI.
I am Dr. Laura Clark. I'm a consultant nephrologist here at Aberdeen Royal Infirmary, and I am the medical lead for the shared care hemodialysis programme.
We set as a specialist nurse, and as a team, we start working from June 2021.
The idea being to try and give patients back some power, be more person-centred. All the centres across Scotland have a degree of shared care patients within their programmes.
At the moment, we are like a 12 patient. They are doing their machine. They are lining the machine. 3 of them as well. They are doing almost everything, like a kind of from shared care. The next transit is a self-care. That's what they are doing just now.
Traditional hospital hemodialysis involves coming on a very rigid fixed schedule 3 times a week, usually for 4 hours each time. Usually it's either a Tuesday, Thursday, Saturday or a Monday, Wednesday, Friday, and it's pretty rigid and fixed. The idea behind shared care and moving on to full self-care, and hopefully as a stepping stone to home hemodialysis, is that gives them a little bit more flexibility. They can do more frequent dialysis, and we know that more frequent dialysis can reduce the requirements for the very strict fluid and diet restrictions that the patients have to go through.
That's the benefit of shared care and self-care. So there is no fixed time schedule for them, so they can come at their convenient time and do dialysis and go home. We have more patients with taking part of shared care, like checking their weight, preparing their pack and trolley, everything ready for them, doing the blood pressure, but doing the machine, lining the machine, and started doing the cannulation. Also, we have the satellite units, so we are getting patients from there as well. Active participation in their treatment, that's the main thing. Active participation make them more positive feeling about the dialysis. Also, the other thing, they can come different timings. There is no fixed schedule. They can come early, do dialysis and go home early. No need to wait for either a nurse or technician to set up their machine. If they are doing the needles, most of the things if they are doing means that's very easy and simple for them.
Having your own room and your own area to do self-care and shared care, I guess, is more relaxing for the patient. They feel that it's not quite so a medical or a medicalised or a clinical procedure that they're going through. It's just part of their day-to-day life.
And the shared care, most of the patients, they do short hours and more days. That's make them more healthy, not much toxin staying in the body. Normal dialysis, we give them 3 days a week. When they do home dialysis, they can do 5 to 6 days a week. It depends on short sessions and more days. That's help them make them more healthy.
It does seem to improve blood pressure control if they do more frequent sessions, and there is less need probably for certain medications around their phosphate control and their anemia treatment.
99% of our patients are involved already in the part of, in the shared care. The shared care means if they're holding the needle side, that's a part of shared care. Or if they're doing the weight, that's a part of shared care. If they can do the blood pressure, temperature, it's a part of shared care. But that's a small part. But if they want to do further up, doing the needle and lining the machine, we want to get more involvement. We need to add on more things. So that's why what we are doing that.
We would look at opening this to any patient who wants to do it. I think the focus is very much on what the patient wants and what they wish, trying to make it more person-centred. Obviously, you need to have some degree of dexterity, but really the programme should be open to everybody who wants to try it.
Oh yeah, we train them. We have a competency training package. It's still under supervision. We used to have one patient He recently got transplant. He was ready to go home dialysis. He learned everything within 12 weeks. He was doing his needle machine, everything, all the competencies signed off. He was ready to go home by the time he got transplant. That's the good news. As per their choice, we are training them first. But gradually, once they learn few sections, they prefer to learn more. Yeah. Initially, they say, "Oh, I'm a bit worried about cannulation, or I don't know how can I manage the machine." But once they started, they're doing very perfect. They're picking up very quickly. They're doing very perfect. It's great, and they're happy to do. Some patients saying like when they do the needles, they don't need to wait for a nurse to do things like that.
Hello, my name is Barry and I'm a self-care dialysis patient. I'm a mum and I work. I run local markets and I do administration for a local property company. So between all that, I find this allows me to manage my treatment alongside my commitments. For me, I guess it was just it was the next step. And I think with this kind of condition, people should be encouraged to do a lot more of a self-care because a lot of the treatment is down to the individual. So I guess it was a gradual process for me. I started doing some of the setting up from the nurses with Jinto, and then I moved on to being more confident myself and knowing I can do it. In the dialysis unit, there was often a wait, it works in a kind of conveyor belt system. Whereas with this, I know exactly I'm going to be in here, what time setting up, and then what time I'm coming off. Freedom, yeah. That's it. There's a flexibility with this. For example, if I have something on maybe on a Monday, I can then change to coming in on a Tuesday. So I started learning the machine in May of last year, and I would say it took a good maybe 3-4 months until I was confident to be fully on my own. It's a very nurse-led process. Jinto, for example, he's very good training, sort of like a nurse instructor. So he would do like checks and little exams to make sure that I was doing things right. It gives more autonomy to me, more independent with it. So I know I'm in here setting up, the machine for me, and I've taken control of my own care. And by doing these processes, you can learn more about yourself and your kidney disease. All the other nurses, they are always there. If you need help with anything, you just press the buzzer. You're never just on your own, especially when you're training. There's always a nurse nearby. So I would encourage it, because if patients are feeling a little nervous and they don't feel confident, just to give it a try, and they'll realise that they're supported all the way through.
So when the patient comes to the clinic, they get an idea, we give the option like a PD, peritoneal dialysis, hemodialysis, and also we can give the option like a shared care, self-care, or home dialysis. That's a leaflet. So we are introducing these things in the beginning itself. So the patient get more idea what they can choose. They have an option to choose.
I would encourage all patients to consider shared care. Well, I think the traditional hemodialysis model really disempowers the patient. They become disengaged with the whole process. The thing that I think patients are telling us now with the shared care, and if they go on to do full self-care, is that they have control back with their own lives and their own health. They have that flexibility, so they can decide themselves when they want to come to have their dialysis session. They don't have to rely on waiting for the nurses to come and put them onto dialysis, which is a major factor that sometimes upsets the patients. They generally feel that their lives are more within their own control rather than having to rely on a nurse.
Oh yes, I enjoy my job. Yeah, I like, and it's like a family. Renal dialysis, we can say it's like a family. We see the patient every day, and we know each other very well. We share the things, their experience, our experience. It's like a family. We can say it's all our patients and the staff.